name is Nate Hellinger, and welcome to my presentation on the melodic intonation therapy for patients with aphasia. During this presentation, we're going to be going over a case study that pioneered some of this research a couple years ago. And we're going to be talking about what happened in their case study, their results, their inclusion and exclusion criteria for their methods, and just some of the basic information on what is aphasia, what kind of patients do they look for specifically, and how did this therapy help them. So starting off, what is aphasia? So aphasia is a language disorder that results from damage to the language centers of the brain. This impairs the person's ability to communicate. What causes it? It's from damage that occurs due to various conditions, whether that's a stroke, which is the most common, a brain injury, or progressive condition like brain tumors or degenerative brain disease. So how does it work? So aphasia is typically caused by damage to the brain's language centers, which are located in primarily the left hemisphere. These are the Broca's area, which is in the frontal lobe, which controls speech production, and the Wernicke's area in the temporal lobe, which is responsible for some language comprehension. So it's important to note that for this study, they focused on patients specifically who had non-fluent aphasia, which is different from fluent aphasia. Non-fluent aphasia is patients who have damage to the Broca's area of the brain. So they can comprehend information, but they can't speak and form coherent sentences. While damage to the Wernicke's area is in the temporal lobe, and that focuses on language comprehension. So they can speak, people with damage to the Wernicke's area, which is fluent aphasia, can speak perfectly fine, fluent, understandable sentences, but they can't comprehend what a person's saying. As opposed to damage to specifically the Broca's area, who can comprehend what a person's saying because they don't have damage to the Wernicke's area, but they can't articulate what they're trying to say in a fluent and coherent sentence. So let's talk about specifically what melodic intonation therapy is. So to define it, it's a speech therapy technique used for specifically people who have non-fluent aphasia. They use melody, rhythm, stress patterns, and a variety of other techniques that are based off song to help people retain the ability to speak. It's going to transition them from intone, which is singing. I'm going to use that word a lot throughout this presentation. Intoned just means a sung phrase, to natural speech. So some core elements of this therapy include sung speech that mimics natural songs and natural speak, hand tapping to reinforce rhythm, whether that's hand, toe, just different things that we're going to talk about a little bit, just reinforce the ability to build rhythm that they can use then later to form any sentence that they want to speak into a song, and then be able to bring that back down a little bit into formed speech through the other hemisphere of their brain, and then gradually fade from a melody, like I just said, into a normal speech pattern. So essentially, how this works is people who have damage to Broca's area can't speak, but they can comprehend what somebody's saying. So essentially what's going to happen is they're going to begin singing all the words that they want to say, since that's in the right hemisphere of the brain, as opposed to Broca's area and Wernicke's area, which are in the left hemisphere. They're going to begin singing everything they want to say, and then be able to gradually build that back down from a song into the ability to relearn how to speak. So how does MIT work? So it's structured into two levels. You have intoned speech and then speech prosody for the second level. The first level includes therapist-led intoning, which is singing phrases, and some hand tapping to be able to build up that rhythm. Then we're going to progress into a joint intone to solo repetition, so just building over that same repetition over and over and over again. Then level 2, once you graduate from level 1, includes transition from the melodic intoning to natural speech, and the use of some speech song to be able to build from the song melody type repetition singing into normal speech, and then build the ability to be able to help others, help people who have gone through this, to take all the sentences that they want to say, build it into a song, and then bring it back down into speech. So some additional information that I want to include here is that this level 1, the patients start with slow phrases that are led by the therapist, that they eventually begin to stay alone. And then level 2, they're going to shift into like the melody section of that, which uses their speech song technique, where rhythms and stresses are retained, but they're going to mimic pitches of normal speech, which is pretty important for this method. Ultimately, the patient speaks in phrases to normal songs, normal sentences, and backup steps included in the study that patients have struggled a little bit, but they were able to build on that and use that later on in life. So getting into some background of this study was one of the very first pioneered cases for people who had who had damage to the Broca's area. This was conducted by Drs. Sparks, Helm, and Albert from the Boston VA, and also from Boston University's medical school. They built on the reports that patients who had aphasia were still able to speak or sing incoherent sentences, even though they weren't able to speak incoherent sentences. The previous music-based therapies lacked evidence, though, so this was an idea that they had heard about, but there wasn't any evidence that backed up this claim. So they begun to use this to actually build further onto that research, and they tapped into some growing research of the right hemisphere and some research of music to be able to transition that into what they wanted to do. Again, some additional information that I would really like to include here is this study was published by these guys. They had noticed that patients who couldn't speak often could sing. Prior effects to using singing therapy had not been shown to show any measurable improvement, so they were really the first people to kind of go through and have some evidence that backed up their claims. And this study emerged at the time when neuroscience was beginning to explore the right hemisphere's role in music and rhythm, so they were kind of a pioneering study in music and rhythm speech therapy as well. And they developed not a sing-along tool, but a structured approach grounded in neuro-linguistics abilities. So what was the purpose of this study? So they wanted to evaluate if MIT as a therapy for severe non-fluent aphasia was actually a reliable option. They determined whether musical elements could facilitate propositional speech, and they wanted to develop a method of avoiding overlearned songs and using intone speech patterns. So they didn't want to use any songs that were really popular or that had a similar melody, because that could be confusing for building on this tool later on. So they wanted to use songs that were more uncommon, that the patients hadn't heard before, to be able to practice developing this rhythmic pattern that they could use and build on over time. They tested MIT in patients with chronic aphasia who were unresponsive to any other testing and other treatments for over 6 months. So they wanted to test out if the treatments that hadn't worked previously, if this was a reliable option to people who were really suffering from non-fluent aphasia that hadn't been able to see any results from other treatments. The researchers wanted to avoid relying on well-known melodies that trigger note response, because they wanted to build on new notes and new techniques to be able to build on the ability to take the information that these clients were learning and build on it, like I said, to be able to transition just the ones that therapists were teaching them into things that they could then, like sentences that they wanted to say, instead of just the normal sentences that therapists had. They wanted to build the ability for these clients to be able to use the same structure, but with the words and phrases that they wanted to say. They thought that was really important. So some of the methods that they included, they used 9 right-handed aphasic patients with left hemisphere stroke. So obviously you can't use somebody with the right hemisphere, because then that's the singing area this study wouldn't work. And they had to be right-handed, obviously, because of the cross-sectional in the brain. If you had somebody who had damage to the left hemisphere, you couldn't have somebody who was left-handed in that situation. So they wanted to target people who were right-handed with a left hemisphere stroke. They also needed to target people who had no speech improvements over the past 6 months of working with different therapies. They wanted somebody that was just based off of their study, obviously to exclude any recent studies that the other patients had tried, influencing the results of their study. So the patients who they used couldn't have any improvement over the last 6 months of the other therapies that they were trying. Some of the inclusion criteria was better auditory comprehension than speech. So they wanted to be able to use patients who could understand information better than they could speak it, obviously because you couldn't have damage to the Wernicke's area, but you could have damage to the Broca's area to be included in this study. They also had to be motivated and socially engaged. They wanted They were looking for patients who genuinely wanted to improve and become better at this ability, and they had to have severely limited expression output. So they couldn't really have any formulated sentences or formulated words for what they were trying to say. They had to be purely just jargon speech. They couldn't have any words that were associated with what they actually wanted to say, even if it was just one word out of that sentence was targeted with the actual sentence they were trying to say. They couldn't even have one word to be included into this study. Some assessments that they did was the Boston Diagnostic Aphasia Examination. They used the repetitive and unison speech testing, and they did a before and after, a pre-MIT and a post-MIT comprehension test to see if this really worked. So let's talk about some of the procedure that went into this. So they used sentence patterns like action, actor, action, object, which an example of that would be I eat soup. They wanted to use basic sentences that were easy to say that people had said a million times in their life before that and build on this ability to just start with some basic stuff. They used some customized melodic annotation patterns. So stuff, like I said earlier, that was not popular. They didn't want to use any popular songs. Just wanted to be customized melodies that they were just learning now to be able to build on their ability to use this information in the future. They avoided melodies from known songs, like I said. They used 10 session requirements for progression. You had to go to 10 sessions and be able to improve on your ability through this therapy. And they did daily individual therapies, and they also did some group therapy, which I thought was interesting because it kind of seemed like a choir practice, you could kind of say. So they used like a big group of people who each had the same issue here, who were each going through the same therapy. They used all of their the people in like a choir practice-esque. They had everybody lined up. They had organized people based off their voice. They started with some warm-ups. They transitioned into more of a like key tone kind of pitch assessment. Then they kind of built into like the melodies, into harmonizing, which I thought was really interesting because they said how important it was to build the rhythm first to be able to use the information that they had learned, the skills and kind of structure of a song, building that melody into the basic words that the therapist provided them and the basic examples of their practice, but then keeping that same movement pattern repetitive so that they could take any sentence, any structure that they wanted to say, build that into the same format to formulate that song through the melodies and rhythm that they had learned, and then bring that back into a normal formed, just typical speech that was coherent, that was fluid, that was fluent in what they were trying to attempt to say. So going over some of the results here, they had 4 patients that had full to near perfect recoveries. They started from a stereotypical jargon-esque speech pattern to a short, meaningful phrase that they could use anytime. So some examples that a lot of patients had, they started with some incoherent structured speech, so like a do, ka type just sounding melody in their songs, to now they were able to say, we go home. So they were able to formulate some basic sentences and articulate what they were trying to say after using some of this therapy. After 6 weeks of post-discharged, so after they weren't in the study anymore, they followed up, and patients were able to say, I came here by car, or they were able to say how they got there, and just build some really specific speech patterns just through the results, and continue to practice like we talked about earlier. They were patients who really wanted to improve. They were able to find some pretty significant results and pretty significant improvement based off this study. 2 patients had minimal speech improvement, which meant that they could use 1 or 2 words that they wanted to use in their new sentences. So maybe they weren't able to say the whole we go home or I came here by car, but they were able to use 2 or 3 of the intended words in that sentence. And then lastly, 2 patients did not have any significant gains, which is too bad. It's upsetting to hear that, but there are a variety of other studies and a variety of other treatments that a lot of people have had really successful results from that they could build on over time. So while 2 people sadly didn't get the results that they wanted, they were at least able to, I'm hoping, use this information on some other treatments later on and hopefully build some better speech patterns over time. And worst case, now they're really great at harmonizing. So I guess that's some condolence. So this is some data analysis. I have two charts here that I would like to share. First, I want to go over just some basic information. The statistical analysis showed significant gains in verbal expressions, such as responsive naming, confrontation of naming, and phase length. In contrast, the tests of auditory comprehension and reading didn't change significantly, suggesting that MIT specifically targets expressive language recovery. So to just kind of talk about what these charts kind of are representing here. So up top we have the responsive, the confronting, and the phase length, and the patient numbered down here. These are the number of words that they were able to say. It goes from 0 to 1.8 coherent words within their study time, anywhere from syllables within the words. Like, so you can see here we have 0.1 of a word, 0.6 of a word, 1 word. So even if they were able to get some syllables out, that was charted in this graph. As you can see, responsive naming, confronting, and phase lengths were all pretty decent after the 6 months of the study. So they were able to get out, multiple patients were able to get out some full phrases, some were only able to get out specific words, and some only had some syllables or no really significant change, like we said. Additionally, they tracked what the phrases that they could actually say were. So here you have commands, complex materials, and a full sentence or paragraph, which was great improvement. Again, we have this chart ranges from 0 to 0.1 to 0.2 all the way up to 1.8. Again, based off how many words or just even syllables that they could say of the intended words that they wanted to say. Again, we have our patients numbered here, and you can see that patients were able to say majority of their commands. They could use complex material, a couple could use complex material, and we had one patient who was able to use a full paragraph after using this technique, which is, again, extreme improvement. So going over just some of the discussion here. So good candidates that they wanted to include had poor expressive speech. Again, they didn't have any ability to take the words that they wanted to say and articulate those into coherent sentences. They weren't even able to use one word to be considered a good candidate for the study. They were preserved auditory comprehension, which means that they could understand what they wanted to say and they could understand what somebody was saying to them, but they couldn't articulate that into a coherent sentence themselves. They had self-awareness and emotional stability, so they were able to understand what was happening, and they had a genuine interest in learning and improving better. They were able to take the improvements, to understand that it's a slow growth, obviously, to be able to improve on something as huge as a stroke. And they had poor repetition skills, so that indicated some room for improvement, excuse me. They had the ability to kind of have some of the similarities of a sentence. They had some of the words that they wanted to say, but they indicated room for improvement, so they couldn't do this on a consistent basis, but they were able to do this every once in a while, which indicated that they would be a good candidate for this study. Additionally, a key insight here is the patients with a stereotypical but clear articulated jargon tended to do a lot better than the patients who didn't have one, so they also were good candidates for this. They had that stereotypical kind of Broca's area damage speech, where they were able to say the kind of like the stereotypical jargon-esque. And our conclusion here for this study, so this MIT offers a compelling treatment for chronic extensive aphasia. So it built on a lot of research built on a lot of ideas that were out there previously, but then this research really showed that there are improvements that can be made for patients who are suffering from excessive aphasia through a melodic intonation therapy. It also helped recover some propositional speech using some music-based techniques that people were able to regain their ability to speak through this therapy. And right hemisphere likely plays a key supportive role through the speech to song ratio here through comprehension. And this study set the stage for a lot of modern neural-rehabilitation using music. This was, again, like I said, one of the pioneering studies for MIT. So they used a lot of studies since then have used the research that they gathered from this first study here, and they were able to build on a lot of new studies and a lot of new information that patients have used and doctors use to this day. So some just last information that I want to include here. This study was groundbreaking because it showed for the very first time that propositional speech could be restored for patients who had a stroke. Even after months or stalled progress, just by basic tapping and music power and rhythmic building through the brain, patients were able to regain that ability to speak and comprehend sentences at a higher level than they were before. So this is just my reference here. Thank you so much for checking out my presentation. I really appreciate it, and I hope you learned something as I went over this presentation. So thank you.